Hello, everybody. Welcome to the Convergence Health Workforce Wellbeing and Violence Prevention Improvement Series. This is our second of 6 sessions, and this week we'll be identifying how patients and family perspectives can be used as a strategy for improvement in the area of workforce well-being and violence prevention. So as a bit of housekeeping before we get started, we welcome folks to be as interactive as possible in this event. We'll be using the chat over the course of this talk for comments, and we'll also be using an interactive tool as well, which you'll get access to in a second, but just get out your phones and we'll be using those as well. All speaker questions, feel free to use the chat and discuss throughout. We'd like this to be as interactive as possible. To introduce myself, I'm Helen Craigie, Project Manager at Convergence Health, and I'll be hosting this series. My background's in bioethics, and I've been working on national quality improvement and patient safety initiatives for over 10 years. And I am honored to be able to explore this important topic with all of you over this series. So as a bit of background, this series was developed based on the growing challenges that our healthcare workforce is facing in the areas of personal well-being and physical safety. So here are just a few examples of information on the topic. I won't take too long, but OSHA estimates that nearly 75% of the 25,000 workplace assaults reported annually happen in the healthcare setting. And as we know that statistic is likely low, as underreporting is a key issue, mostly due to people having a negative view of the effectiveness of policies for managing violence and dismissing maltreatment as part of the job. So workforce violence is a leading cause of job dissatisfaction among providers, linked to burnout, absenteeism, and reduced worker retention. As we all know, COVID-19 exposed and amplified underlying issues, including absence of trust among team members, lack of adequate time for patient and self-care, and a lack of psychological safety in the healthcare setting. Violence in the workplace can lead to negative psychological consequences such as low self-esteem, increased anxiety, and stress. And so to address this topic, Convergence Health is looking beyond just workplace violence and taking a really broad approach. So here is a schedule of our series. We're currently in the session 2, Creating Healing Environment More Than a Message. And beyond this, we'll be looking at leadership-driven workforce well-being. We'll be looking at a peer example from Parkland Hospital down in Texas. We'll be looking at how to put the pieces together at the local level at your own hospital using high reliability principles. And we'll be learning from about violence prevention from a critical access hospital as well to close out our series. So join us for the next series of Wednesdays. We're really excited about having you. So without further ado, I am going to introduce our speakers for today, Libby Hoy and Lindsay Galley, who will introduce themselves today by answering the following 3 questions for all of us. So why is this topic important to you, workforce well-being and violence prevention? Why is it important to all of us here today? And why is this important for all of us in general in these times? So Lindsay and Libby, I hand it over to you.
Awesome. Thanks so much, Helen. Appreciate that introduction. I'll go ahead and kick us off and then pass it to Libby. I'm Lindsay Galley. I'm the Vice President of Programs at PFCC Partners. This topic is important to me. You can read through my bio, but I originally started in healthcare as the administrative assistant in the safety department. So safety has kind of been on my mind since I started in the healthcare field. And, beyond that, I have lived experience through my family and personally as well, where we have seen situations that could have gone in not the right direction. But with partnership, collaboration, and communication, I do believe we're able to move through incidences where people feel unsafe at work and in their workplace. I think it's important for us to continue talking about today because I've heard an old proverb that says the best time to plant a tree was 20 years ago and the next best time is today. So I think today is the perfect time to continue this conversation and this discussion, especially with those statistics that Helen had just shared as well. I will pass it off to Libby to introduce herself.
Thank you, Lindsay and Helen. It's great to be here with all of you on this really, really important topic. Why this is important to me on a very personal level. My daughter-in-law is a nurse on a med-surg floor in Southern California, and I need her to be safe. She's a mommy of a sweet little guy, and she deserves to be safe at work. She works really hard. She's very compassionate. And I don't want that compassion, that natural empathy that she has to go anywhere. I want that to be um, uh, in the context of a nurturing and healing environment. So that's my personal, my why are we all here together is to be together in this and reduce any sense of us and them, staff versus patients or staff versus patients and family caregivers. And so we all want to feel safe in the healthcare environment. So how can we work together? How can we build some bridges and work together to create the kind of environment we both want to be in? And I think, in the broader sense of the world, we need this. We need to focus on this. We need to focus on each other's well-being and on our own well-being and too. So that's why this is important to me. And yeah, glad to be here today.
Great. Thank you, Libby. Well said. Yeah, we can't or are unable to have healthy patients and family caregivers without a healthy healthcare workforce. All right, so our topic today is creating healing environments, more than a message. So we'll be looking at from a patient and family caregiver perspective, and then a lot of this comes through conversations that we've had with healthcare staff, with patients, with family caregivers, with patient family partners who have collaborated with their healthcare organizations on safety interventions, and really looking beyond the message, beyond the signage, and looking at creating those healing environments where people feel safe to heal. Everyone, every single one of us. So a little about our organization. You can see here our mission, vision, and values, but at PFCC Partners, and I think globally, we recognize that healthcare is a really complex place and really difficult to create change within healthcare, and it takes a long time. So we partner with healthcare organizations like Convergence to open space for patients and family caregivers to share their lived experience in order to influence improvement. Our vision is a health system that is completely transformed and one that works with people and through communities as a partner in their well-being. And we bring all of these values to our partnership with Convergence and others. And I think you'll see a lot of these values represented in our presentation today as well. We do have one more co-presenter who is joining us via a recorded interview because she was unable to be with us today. So I would like to, here we go, introduce Karen Anthony. So Karen is a very passionate mother who has a child with healthcare needs and has really been by his side for a long time, and has seen the ups and downs of what safety looks like in the healthcare environment from both that parent side, but as well as she is a member of her hospital's Patient Family Advisory Council in Washington, D.C. So here, Karen has responded to the same questions that Libby and I did, why it's important, why this topic is important to her and for us here today. She's really sharing the concept of bringing us all together to create that nurturing, healing environment. So here, let me make sure I'm sharing my sound. Okay.
the workforce in healthcare is precious and stressed. And that's the reason I want them to feel safe, and I want them to feel seen and heard and cared for. We need them, and we learned that the hard way during COVID. And the folks who are still there have been through quite an ordeal, and I have so much gratitude for the work that they continue to do to stay in it, even when budgets are cut and staff is short. So I want them to be there and to feel like this is that they are fulfilling the work that they chose to do on purpose. That no one who comes into this field does it because, well, it's a fine job. They do it because they want to help people. So you want to nurture that and support that. And safety is the way that you do that. But I want safety to come from a place of what we're really doing actually makes people safer, and does it in a way that looks at safety of everybody. Because if we get into a punitive framework for that, then I worry that families and patients their safety is also at stake in some of this. If we're trying to control things too much, and we worry it's too subjective, it's not consistent, it makes we miss out on on serving as many people as possible and including as many ideas and perspectives as possible. So yes, we should make sure that no one is going through something where they feel like their patients or family members are abusing staff. That's terrible, and it's unacceptable. And we shouldn't make someone be judged and harmed and punished for the worst thing they do on a terrible day for themselves and their family. Everybody's not at their best when they've taken their child or their beloved family member to a hospital or even just to the doctor to handle a problem. So we want to do that with the most compassion possible and be safe. And I think we can do both. I don't think you need to say, one strike and you're out. If you yell at the person, you can't come back in the building, because I don't think that serves anybody. I think there are better ways to serve that.
Yeah. All right, so we'll hear a little bit more from Karen, and I've so appreciated her message because that's really what it's about. It's nurturing that reason why people get into healthcare in the first place. So excited to hear a little bit more from Karen. So our objectives for the rest of our 45 minutes or so together is to one, understand some of the elements of a comprehensive violence prevention program, and that is we want to hear from you and what that looks like at your hospitals. We'll also talk through some new strategies to engage patient and family caregivers in creating healing environments. And then finally, understand how patient-family partners are working to improve workforce wellness, and that's through the perspective of Karen as well. All right, so we will be using an app called Slido. You can join by going to slido.com and using this code 1162009, or by simply taking your smartphone and hovering over the QR code using your camera. That should take us to the first polling question that we have up today. On Slido, you'll also see a tab for Q&A. If you have any questions through the presentation today, you can put questions right directly into the app there. Or, of course, you can use chat or come off mute as well. That always works too. Thank you, Tracy, for putting that number in the chat. And we'll go to our first poll. So I would love to know what workforce safety currently looks like at your hospital, or violence prevention programs. What does that look like? Do you have signage up? Is de-escalation training provided? Have you implemented additional security? Or is there something else, something creative that your hospital is doing that you would like to add in the chat? All right. So a lot of folks, and this is consistent with conversations that we've had with hospitals as well, with the signage and de-escalation training being those top two programs that are being implemented. We've heard a lot about additional security and would love to see the other. Yeah, please share. It looks like a few people have also added other and would love to see what else your hospital is doing. If you could add those in the chat, or you're welcome to come off mute as well. Okay, Heather, education for staff. Great. Any others?
At Sarah's hospital, they're looking at metal detectors at the ED and main entrances.
Okay. Thank you for sharing that, Sarah. Yeah, another one that we've seen and had a long conversation, which we'll talk about shortly, but about metal detectors versus weapon detectors at certain hospitals as well. Bailey shares 2-person magnet on the door frame to let team members know if of patient risk and to have someone go in the room with them for extra safety. So 2 people together. Very interesting. Great. And Bailey, I might ask you, because we've heard about who responds to, violent incidences, and curious if there is a purpose of who those 2 people are, their roles within the hospital, if it's a nurse and a support nurse, curious what their roles are. And you're all welcome to come off mute too. I would love to hear you. Just taking a minute to respond, and that's okay too. We'll wait for your response, Bailey, but appreciate those sharing, a few other things that your hospitals are doing. And again, quite consistent with a lot of the conversations that we have been having. And so kind of what we have been seeing in a lot of discussions is this current state of workforce safety. Oh, and Bailey?
Hey, sorry, I had to find the mute button on Zoom. Um, so we do like the team member advantage or 2-person magnet, and it's just for team members who are like walking into that room that might not have opened that patient's chart. The patient's been identified as like a risk for violence. And so we usually want it to be like a nurse who's been kind of trained, but we teach situational awareness to everybody, and then they bring in somebody with them. So like while they're doing whatever they need to do in the room, somebody's there kind of watching the patient and helping like speed the process up so they're in that room for a shorter amount of time. But we do a whole bunch of training to all the people like throughout our facility, not just nursing staff, that know what that sign means and then kind of have the opportunity to learn what we mean by it.
I'm curious, Bailey, that sounds like a really great sort of subtle signal in the environment that helps people to feel, helps staff to feel safe. I'm curious if you have like a risk assessment tool. Is like, how do you decide, or how does staff decide if a person is at risk for violence?
Yeah, so right now it is, we've seen it as like a response to when they have been violent or they're starting to escalate. But our
Okay.
team is working on implementing a risk assessment tool. I think it's the VPAT. We had looked at the Rosette violence checklist before, but this is a little bit different, and we hope to implement it soon. And then we're also looking at a way of tracking it in our system so that people who, an easy one is people who have a reaction after anesthesia that's typically violent. We want to be able to flag them in our system so that like our people who know, like in PACU, that they're about to wake up a person or deal with a person that's waking up that could be violent. And so we're kind of working through that process right now with our workplace violence prevention team.
Great. Thank you so much, Bailey.
Yeah.
That's awesome. I hadn't heard of that before. So the
Me
power
either,
of
yeah.
peer learning, right? Bringing
Yes.
everybody together and learning together. Thanks so much, Bailey.
Yeah, absolutely. That's what this is all about. And we have been doing a lot of learning, obviously here today, learning more about the risk assessment too. And Bailey, if you don't mind putting the name of that in the chat, I think others are interested in what that is called as well. Awesome. Thank you. So again, we've been having a lot of conversations, and a lot of the, prevention programs that we're seeing are focused on a message of zero tolerance and, having signage, additional security, focusing on de-escalation, which can be really powerful in these incidences of violence. But then beyond that, we've seen how bias may come into play, who is responding to violent incidences, additional security, and, how that impacts the patients and family caregivers. I think we were just talking yesterday, and someone had showed up to the hospital where they had oh, sorry, I got distracted, where they had metal detectors, and it shocked the patient who was going to that hospital. Why am I going through a metal detector to make sure that I'm getting healthy at my hospital or healthcare center? And we've seen, messages around implications and some adversarial types of messages. So this is kind of that current state that we're looking at. And we've seen this through multiple conversations and perspectives that have been highlighted over the past month or so. So we really like to listen first before we start talking. So we listen a lot here, and a few places that we have been listening are one, the Convergence Patient-Family Partnership community. We've had a few conversations with patients and family caregivers who are representative of the states that Convergence has been working in. And Libby, I know we had just chatted with them. I feel like that was yesterday, because I think it was, but wanted to see if there was anything else from the Convergence Patient Family Partnership community that you wanted to highlight.
Yeah, a lot of passion, a lot of compassion coming from our patient family partners and expressing their desire to support workforce wellness. And, the example that you gave, Lindsay, around the one patient family partner who was so taken aback that there was a metal detector at the ED entrance. And then we had another patient family partner who lives in Chicago, and that's just typical and part of the environment. So I think that's another message that we keep hearing, is tapping into your local patient family partner community is going to give you that relevant, community-based kind of solutions. And I think that's really where the power of partnering on workforce safety it really comes into play, because no one knows your communities better than your community members. And so leveraging that insight to help you be effective in your workforce safety programs, I think, can be just another added resource to your work.
Yeah, absolutely. Yeah, that more localized effort and hearing what works and what doesn't more locally through your own patients and family caregivers is essential. And so we've also talked to hospital staff and maybe some of you on the recent Convergence Patient Family Engagement for Equity think tank. I believe that was the April think tank, actually, just to start to gather, some just a better understanding of the prevention programs that your hospitals have. So that's a lot of what we have been hearing as well. And then finally, through our network of patient family advisors, the PFA network, we have monthly coffee chats, and back in April had a focus on workforce well-being and safety with patient family advisors. And we actually had a number of patient family advisory council facilitators, so staff, who were on and shared a lot with us as well. think one of the things that stuck out to me was one of the advisory council facilitators had shared that their leadership wanted to implement a canine unit to kind of walk in their emergency department. And they brought that idea to the advisory council, who, you know, had kind of a didn't like that idea. But they were still moving forward with implementing it. And so another thing, you know, if you will be touching base and having conversations and learning about the experiences of patients and family caregivers, it's important to one, make sure that you have the opportunity to create changes or improvements based on what they shared, and that if you're listening to them, that their perspective will be taken into consideration when having conversations around this. This is also where I had a great conversation with Karen Anthony. So in this next clip, it's about 8 minutes long. We start off by talking about what her hospital has been doing around workforce well-being and safety and violence prevention. My question gets a little cut off in the beginning, but that is what Karen is responding to. So we'll go ahead and play that. Incidences and you know, this whole topic of workforce safety.
Yeah. So one of the things that was really important is to figure out a way to respond to a potentially volatile situation with somebody other than just security. And that's to make security's job easier. That's to make sure that we can take care of whatever need is bubbling up in that. And I'd like to see that I'd like to think that security is getting training on de-escalating a situation for sure. But sometimes that meant social worker or a chaplain, or maybe it means, oh, your child's in there for days on end, and maybe it's just the nurse who knows your family. But having a practice of making the personal connection for this person who is having a difficult time. And bias comes in with the idea of who needs to have this call made, because someone in one circumstance, one person may say, Karen is angry and frustrated because her kid has been inpatient for the last 24 hours and isn't allowed to eat or drink until something's going to happen. And she's agitated because this has gone on a long time. And some people are going to say, well, that's just an agitated parent who's looking out for her kid. And somebody else might say, she's being threatening. Her anger seems out of control to me. You don't know how people are perceiving this. And there's plenty of research and life experience out in the world that says some people find other people in different circumstances that are different than them to be more or less relatable. And the less relatable they are, the more likely they are to say, I don't know what I'm going to do with this person. I can't figure this out. I'm just going to call security because I don't want this to go off the rails.
Right.
But that means that it gets applied in a rather subjective way and can be applied quite unfairly. And I've heard lots and lots of stories of people just moving through their lives that are already very difficult because I come through a pediatric hospital, because their child is in the hospital. They're already in a crisis place. Yeah. But then to have other things thrown in. One person I know whose 14-year-old son was stopped several days in a row walking from the cafeteria back to his siblings' room by, what are you doing here? Why aren't you, do you have the right to be here? And it just felt like harassment because somebody looked at this 14-year-old boy and decided that he didn't look like someone who belonged to be there. Or I've definitely heard stories from other parents who got into an angry argument with someone on staff, and it became the staff member didn't want to deal, and it turned into, okay, well, we're going to get security to do this. Or you come up with a behavior modification plan for someone who was really just very frustrated because it was the fifth problem that had come up and people were not giving them a straight answer. And now the parent is being seen as a problem,
Right.
rather than the family needs to be taken care of and what can we do to deal with that. There was a time when my son was being treated at the hospital where he got really bad news that was very unexpected. And he was at the time 19. And the team left the room. I was in the room with him and the nurse, and he started knocking stuff down and throwing things. And he was just in full rage response, which made a lot of sense given what he had heard. But we all left the room, shut the door, gave him privacy, gave him a chance to cool down. He didn't break anything expensive. I guess that could have happened, but no one called security on him. Nobody said, here's a 19-year-old young man who is damaging property and is a danger to staff. They understood that this was going on. They gave him a few minutes to chill out, and then they figured out a way to come in there.
Yeah.
I don't know that everybody would have gotten the same grace in that situation.
Yeah. I think that's such a great example too of, you as your son's mom and knowing him so well, knowing that he needs a few minutes to, just let this out. This is hard to go through, to be able to work with, nursing staff, or having the nursing staff or physician, whoever was there, understand that this time was needed and be able to work with you to take that time away. That's just such a great example. And I wanted to ask, even further, how do we make sure that the family caregiver and the patient voices are heard and they're invited in and they're a part of, none of us want to see violence happening in healthcare or anywhere else, we're all in this together. So
I mean,
how do we do that?
I have so much profound respect and gratitude for the healthcare staff and the just hospital staff, the EVS workers and the cafeteria workers and the parking guys. They did so much to make my family's life better when we were going through this. And of course, they deserve to have a safe environment, and no one should be behaving inappropriately or violently in any way, shape, or form. And my son's behavior was inappropriate, but we did, it was not the right, but we gave the grace to say that sometimes you need to let him have his feelings, and he's not going to sit there with his hands folded in his lap. And as long as he's not hurting himself or anybody else or doing any real damage, but knocking over an IV pole and flipping over a chair, that's probably an okay thing to do. How you have the family voice it needs to be integral in multiple layers of what's going on within the system. It needs to be, I'm a big believer, obviously, in the Patient Family Advisory Council, and there are patient advisory councils by specialty area, or also we have one for global services, we have ones for different locations and things. And that's a great way to understand what is going on from that perspective. What's it like in BMT, or what's it like in the CCU or the ED or anything like that. But also it's really excellent to have a family member or a patient, if you can, be part of committees of the hospital that are looking at policy and practice. So I know that I sat on the Patient Experience Steering Committee when I was chair of PFAC, and that was really valuable because they're looking at patient experience feedback, and I could talk to what was it like to be the person who wrote the survey that gave those survey responses, or what that was like. Right. There's a colleague and friend of mine who's on the patient-facing technology committee to say, what's it like to use the portal? I know someone who's on the pain management committee, having folks with lived experience, not that obviously they're not the only experts in the room, but having them part of the conversation is really, really integral. At Children's, the PFAC that I'm on, I'm really proud to say we're going to be doing our third grand rounds this year. We've done them the last couple of years, and that's saying we believe that what PFAC has to offer is at the same level of importance in medical education as someone who wants to learn about a new procedure or a new drug or a new public health trend or whatever else that they want to teach. PFAC has something, is a partner in that way. And that's really powerful to do that. It has to be built into the culture in that way, and not just in the, let's hear the inspiring story of the patient journey.
Right.
That's nice. And I'm glad people learn about that, but that's insufficient. Really need to get deeper into the works.
Incidences and sorry. um So we have a full interview available with Karen. We ended up talking for about 30 minutes, and we'll make that available to everyone after, so you could hear even more of her perspective. I know for me, I appreciate her kind of holistic view of workforce safety from all sides, and experiencing it as well. But curious how what Karen shared kind of lands on everyone, or has anyone brought this topic to maybe your hospital's advisory council or conversations with other patients. Yeah, just kind of curious if there was anything that jumped out from what Karen had shared. Maybe you need a few more minutes to let it sink in, and maybe this the next section of our presentation will even highlight more of what Karen had shared. So I am going to pass it off to Libby now.
Great.
Libby?
Thank you. If I can find my voice. So a couple of months ago, I took my father-in-law, my 84-year-old father-in-law with a large wound on his leg, to an emergency room. And when I walked in there, I noticed the signage right away. And I have to say, I have logged hundreds, probably even thousands of hours in emergency departments in the last 25 years of raising 3 kids with special healthcare needs. So I've been in a lot of EDs, and this signage and this the environment was really different and new for me. And so when I walked in, I felt immediately kind of at ease and part of the environment. I saw the first word I saw was safe. Oh, I'm sorry. Oh, the first word I saw was safe, and that really just brought my shoulders down. It brought my father-in-law's shoulders down, and we felt safe in this environment. And there was a friendly picture, a gentleman smiling at us. The healthcare worker on the ground, obviously in frustration and tired, fatigued. It just evokes compassion, right? All hands on deck. It's another invitation that we're all part of the environment. And so we're all part of contributing to the safety of the environment. And so, see something, say something. That empowers people to speak up. It also just reminds people to be aware of their surroundings, which can be really helpful. Again, this shouldn't just land on the staff to be vigilant in an environment, but rather we can invite others in as well. And so I just want you to sit for a minute and look at these signs and see, do your shoulders go up or do they go down? Can you breathe? Or are you feeling nervous, right? What does that do? I'll let you sit with that for a minute quietly. Yeah, Heather, mine too, down. Now, I was really lucky because I had heard that there was some other signage out there that was a little bit more aggressive. And so I kind of did a search to see what those looked like. And so on the next slide, how do you feel? Look at the anger in that character's facial expression. Stop, warning, warning. How do you feel? Like, ooh, okay. Right? So in terms of the signage, just as we always talk about words mattering, mattering, is that a word? Words matter, right? So do the words on our signage. They can set a tone for the emergency department. The emergency department is filled with anxiety. Nobody's in the emergency department because they feel good, they're relaxed, they're having a great day, or they're going to Disneyland. They're there because something is wrong and they don't know what it is. Something is scary. And so the signage can like put gas on that fire, or it can really calm the environment. So just being thoughtful about signage is really important. But I think that Karen's point is really well taken. And that is kind of thinking about all of this on the next slide, if you would, Lindsay. Thinking about the larger context, like what else are those triggers in your environment that you can control for, or at least you can try to control for. So awareness, number one, I am telling you, we talk to patients and families across the country all the time. I would say the vast majority have no awareness of the extent of the problem of workforce violence against healthcare workers. My my older sister went to an emergency room and she called me immediately and said, "Why are all these signs around here saying stop the violence, stop the violence?" What is going on? She had no idea of the extent. So creating awareness helps to build another team member. It helps to build and empower that person, that patient, that family caregiver that's sitting in your emergency department to be part of the team, to be pulled into creating a safe environment, as opposed to being told, stop, hold up. I'm worried about you, right? So awareness, I think, is a really big thing. I loved this poster. I thought, I think it was from the American Hospital Association. It's far too small for me to see at this point, but it's I appreciated the awareness building of the problem. And then the invitation. Healing happens here. Inviting your patients and your family caregivers that are in the environment into this team sport of keeping healthcare environment safe. And this is what worries me most of all. In healthcare, we tend to see an adversarial relationship between staff and patients and families. Not everywhere, certainly, but there is that underlying current. And this workforce violence crisis that we're having has the potential to drive us further apart. And that really worries me, because I think care is safer and higher quality when we're working together. So again, bringing patients and family caregivers into creating the healing environment is a great way to partner. It's a great way to get those insights. And I wanted to say, I was on a patient family advisory council many, many years ago where we were looking at different security measures, and I love all the variety of programs that you all have mentioned today. I think that shows demonstrates some really broad thinking. And we were talking about specifically de-escalation and writing a policy about de-escalation that wasn't rooted in like Bailey's program, wasn't rooted in an assessment, but was really just rooted in somebody's opinion as to whether this person was violent or not. And so we were talking about that, and it occurred to me that it's really dangerous practice to write a policy for 10% of people. So if we have 10% of people in the environment that have the potential or have been violent, and I'm not saying that it doesn't happen, I know it does, but if that's 10%, are we writing a policy that covers the other 90%? and puts them in a bucket that makes them more anxious, makes them more, agitated in the environment? Can we write a policy that covers the 90% and add in layers to respond to the 10%? So hopefully that makes sense. Lindsay, does that make sense?
Yes, yeah, absolutely.
Okay. Awesome. So yeah, just, thinking about as you're developing policies and procedures around workforce violence, recognizing that the majority of your patients are not going to be violent. And so you want to nurture that kind of engagement in the healthy environment, and then make plans, right? Make plans for that 10% who are going to be violent or who may have that potential. So just a couple of things around that invitation. And then the physical environment. Oh my goodness, what a difference the physical environment can make. You see up on the top, and I think everybody I've showed this picture to said, oh, that's a DMV office. How do you feel when you're in the DMV? I get agitated. I'm like, oh, this is going to take forever. So it's mess, disorganized, all of it, right? And part of it is because you're vulnerable. You're sitting out there in the middle and you've got no cover. You've got no, everything is just monotone. Everybody's the same. Versus the environment in the lower picture where physically you have some sort of ability to have some privacy, or at least not be, face forward, everybody in one uniform, very kind of, what do you call that? Not inhumane, but where the humanity is kind of taken out of the perspective. Again, we did a great project where patient family partners helped us to put fake plants in between some chairs. Again, just to give people that little sense of, I'm not in somebody else's face, because that too can really increase the agitation. Another opportunity we had was to work with the security department to think about how they responded, and Karen spoke to this as well, how they responded to those de-escalations. I was so glad to see so many de-escalation programs on this call today. I think there's real value in that, not thinking about this violence as violence and nonviolence, black and white, but as a continuum. And if we can catch it early, we can divert and de-escalate. So love that work is going on. And so we kind of helped the security department to think about, if it's really upstream, can we, as Karen suggested, use other actors, if you will, in the de-escalation process? Does it have to be a fully uniformed security guard? Or could it be someone who represents the community? Could it be someone that speaks the language of the person who's getting agitated and that sort of thing? So social workers, others who are trained in this de-escalation world. So just thinking about the physical environment, how are you inviting patients and families in your emergency departments into the goal of making a healing environment? And then, building awareness of the problem. I really think this is something we really need to do alongside our workforce safety. Like, this is why we're doing workforce safety. And then, of course, on the next slide, I think we can go. So how do you invite people in? The neighborhood watch, I think, is a great, it was not my example. I think Helen came up with this actually, but it was a really great example, right? Everybody knows what a neighborhood watch is, right? Everybody knows that people are looking out for each other. How do we create that same sense in an emergency department? Speaking up for safety and, of course, patient family partner engagement. And if you don't have a PFAC, on the next slide, here's some other ways you can consider getting that insight into the perspective of the patient and family. And as I mentioned before, it's really a local kind of, so it has to be a local solution, because what works for us in Los Angeles County is probably not going to work in a rural community in Iowa. And so that's the purpose of engaging your patient and family partners. And so if you have a patient family advisory committee, absolutely, bringing them in. And I was thinking, as Lindsay gave the example of the hospital that brought forward bringing the dogs into the emergency room. I wonder if that conversation was preceded by awareness building with that PFAC. Did that PFAC know the extent of the problem in that hospital? Did the hospital share data with the number of incidences? And we know those are underreported, but you know, what happened there so that there was this a bit of a disconnect? So, you know, again, there's many different ways to engage. You can do interviews, you can do surveys, focus groups. You can test signage out with groups of patients and families in listening sessions. You can start to think about opening the space to say, what else could we be doing? What else do you think would be help to create that healing environment that we're all committed to? So if I guess that's all to say, if you don't have a patient family advisory council, you're not off the hook for patient engagement. You can still have a conversation. You can still have get that input to inform your workforce safety so that we're not dividing any further, but we're really coming together on this critically important topic.
Absolutely. Thank you, Libby. So with that, and I'll leave this up for just another minute, we would like to know, in hearing from everything today, hearing from Libby and Karen and seeing, you know, these other opportunities for engagement, what is one thing that your hospital can do to engage patients and family caregivers who are at your hospital in workforce safety or in violence prevention? So, for an example, can you start a survey in the emergency department for creating a healing environment? You know, a little box where people can write what a healing environment means to them. So what's one thing that your hospital can do to engage? Please chat in. Can be something really small. Maybe you can just have a conversation. Maybe you have some signage options and can do a survey. Which do you like better? Put a ticket in. Brittany, inform patients and their families if you see something, say something, and what number to call. That's a great way to just start inviting people in. Yeah.
How empowering would that be, right?
Oh, yeah.
Thanks,
Yes.
Brittany.
I always loved speak up for safety, but inviting, patients and family caregivers into that as well. Heather shared, we are a small rural healthcare center in Montana, but this made me think of some of the facilities back east I worked for. Definitely work on signage to get the conversations going. Great. Chuck, looks like you have an advisory council at your hospital. So what a great resource to utilize them to review current signage, policies, procedures, and get that community perspective on how they perceive or respond or feel about certain parts of the program. Love that.
And Chuck, since you have that touch point, I would also just sort of ask them about workforce safety. How much of a problem do they think that it is? And think about some of that awareness building upstream, because if you do have PFAC members, or even if you run a listening session, you know, where patients and families are giving you input on things like signage and on that contextual overall program, they also can be the best messengers to your community as to why you're doing these things. So once they come in, and we naturally have that compassion that Karen talked about. We want to make the workforce safer for healthcare providers. We need you guys, right? So once you invite that patient and family advisory councils in, they then can become conduits to the community and messengers of, you know, why you're taking these steps and why people are seeing these signage in your EDs.
Yeah, absolutely. Great. Well, thank you, everyone. Those are some great small steps that can, you know, lead to even bigger conversations and bigger programs and updates to policies to ensure that you're creating this healing environment that engages patients and family caregivers as well. So we have one more poll. Would love to see one word. I think you have the option to do more than one word, but one word that describes a future state of workforce safety that engages patients and family caregivers. What does that look like? And I guess I would say patients and family caregivers and nursing staff and physicians and security and social workers, everybody. What's one word that describes that future state? Teamwork. I love that, Heather. Yes. Yeah, and if you aren't able to get on Slido, please put those in put your words in the chat. Together. Inclusive. See people typing. Yes, awareness. Just what we were talking about, building that awareness. Joe, we have partnership. Psychological safety is coming up. Great. Partnership. Getting bigger. Awesome. We'll keep those responses coming. We will share the final word cloud of, you know, our teamwork and together and our partnership and workforce safety, because we are, yes, all in this together, and appreciate all of you for responding to that poll. And just want to thank you all. I know we have a few minutes left. If we don't get to your questions today, please feel free to reach out to myself or Libby. Our emails are in the slide deck and on your screen right there. But at this time, yeah, I think we have 2 more minutes to see if there's any questions. If Slido's working. If not, please put your questions in the chat. That probably works a little bit better. Libby told me that the Q&A wasn't working.
I see Libby's note in the chat. Just thank you both of you so much, Libby and Lindsay. This was just great. What a valuable perspective you bring to all of us and to share with us today. You know, exploring the topic of patient and family engagement as a strategy for improvement is just so important. So we really appreciate your time and effort today. It was very enlightening. It was wonderful to hear from you and from Karen as well. So definitely thank her. And absolutely, can we share the emails again? Perfect. And we'll also be sharing the slides and recording, and you can watch Karen's full recording as well. We'll send that out. Thanks, Annette. And join us next week where we'll be looking at leadership-driven workforce well-being. So University of Miami's approach, taking it from the HR perspective and looking at workforce well-being from that leadership-driven perspective. So thank you so much, Libby and Lindsay from PFCC Partners. Oh, thanks for sharing your email addresses. And absolutely reach out to PFCC Partners. They will respond. They're happy to work with you and figure out how you can engage your patients and families at the local level at your hospital. So thank you, everybody, for coming today. We look forward to seeing you next week for our next session. And yeah, absolutely. Share your email addresses if you'd like to keep in touch as well in the chat box. Really appreciate the togetherness. So Thank you, everybody. Have a great rest of your day. I will see you next week. Thank you.
Thank you. Appreciate everyone's time today.
Appreciate your time.